The meeting of the Board of Ellis County Commission will now come to order. Let's stand for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
And Donna, please note that Commissioner Hazelhorse is not here tonight, and Commissioner Ross and myself are. Any changes to the order of business? I think we have one executive session this evening.
Okay.
And prior minutes, did you get a chance to look at those, Commissioner?
Yeah, I didn't see any issues with
I
them.
read through them. I thought they were okay, so the minutes will stand as presented. Do I hear a motion for the consent agenda?
Yes, Mr. Chair, I move we approve consent agenda items A through G as presented.
I'll second that motion. All in favor say aye.
Aye.
Motion passes 2-0. Issues from persons not on the order of business. I believe Donna has something to say.
Well, I'm excited to say ballots were received today. So that's very exciting. They reported the state of Kansas has over 400,000 requests to have an advance ballot mailed. Just kind of wanted to let you know what's happening in Ellis County. First of all, I want to give a big thanks to Commissioner Slyer and his wife Mary. They came in last week and helped with that process, so I sincerely appreciate that. We currently have 3,702 requests for advance ballots to be mailed, and we keep receiving. Today we had 100 more in the mail and through the email, so that number will keep increasing, I'm sure. So it is exciting. Things coming up, October 13th is the last day that you can get registered to vote to be qualified for the November 3rd general election. So if you've moved, changed your name, or are not currently on the registration roll, you need to get registered. You can go in on the website, lsco.net, or come into our office at 718 Main at the Administrative Center. In advance voting, we've had lots of questions on that. A lot of people have came in ready to vote, and that will begin on Monday, October the 19th from 8 a.m. until 4 p.m. weekdays through November the 2nd, the day before election, from 8 a.m. till noon. So that's just to share a little bit of information with you. Thank you.
Okay, thank you,
Don,
Donna.
I have one question for you. How long do people have to request an advance ballot?
That's a good question. October 27th is the last day that they could request a ballot to be mailed.
Okay.
And of course, coming back, it has to be dated by the post office by election day or prior, and we have to receive it before that Friday of election week.
Okay.
Anything else?
No.
Thank you.
For me. Okay, is there any introduction of new? Yeah, Darren.
Evening, Commission. Darren Myers, Director of Fire and Emergency Management. I just want to give the Commission an update. I spoke to JD earlier, it was either today or last week, but in regards to the CDBG-CV funds the Ellis County has applied for and awarded, I just need the Commission to sign the authorization for the signature on the payments. And if the Commission so chooses to do that, I'll just meet with you after the meeting tonight and you can sign that form. We're pretty much ready to go on it. We got the applications all set. We got the website on the Ellis County website loaded. It's just not live yet until we go live with it. And we kind of just waited. JD and I discussed on when to proceed, and we just wanted to get the CARES under our feet a little bit and test the waters on that before we released into the CDBG funds. So
Absolutely.
hopefully here within the next couple of weeks we'll get that live and start receiving applications, and won't be on such a strict timeline like the CARES funding, because I think we have until August of 2021, about a year to expend those funds.
Mm-hmm.
Darren,
Sounds good.
One of the things that's been asked of me by a lot of my friends in the business community is, well, one, I told them about this, but I knew that was quite a bit less available funding than before. But basically our advertising effort, I guess, in order to allow them to know what they can do and who qualifies and that kind of stuff. I think whether that be next meeting or whenever, if we could go over those guidelines and then allow us in whatever way that we can as commissioners, as city leaders. I see the chamber back here and stuff like that. The ways that we can get that out to people, so we can get as equitable funding out on that as possible.
Yeah, fortunately, like I said, the time frame is crunched, so we're going to have a longer application process period. We won't be able to do the online portal like we were before just because of the type of application. For instance, if you apply for the funding, you have to go off your income of your employees. And for that, every one of your employees has to fill out a form.
Oh.
So for us to do that online, it would almost be impossible the way our online stuff is set up. But we'll have all the applications online, what is required, what the explanations are, and an actual application process, unlike what we had with the CARES funding a little bit, so we can ask a little bit more questions. Did you get PPV or PPP money? Did you get CARES money? Did you get other type of federal or state assistance? So that way we can try to spread that money out around a little bit better than somebody getting 5 different sources of funding and somebody not having a chance to get any. Like I say, the time frame will be open a little bit longer than the CARES because we don't have any restrictions there, and it's kind of where we're at. We're kind of looking at, I don't remember the number in my head. There's 2 different types of funding that'll be available based on the size of your business, 5 employees with the owner or less, and then up to 50. And then based on the amount of applications that we get, we'll be able to determine how many and what size of grant payments we can give out. We're looking, I believe, at, I don't remember the numbers off my top of my head, 3,000 and 5,000 between there for the small, and then 5,000 to 10,000, I think, on the other ones. And about a dozen awards for each of those 2, or we'll be able to split them out depending on how many applications we get.
Sounds like more of a normal government grant where it's a little more paper intensive and a little more back checking than the other. Okay.
But we got plenty of time to spend $132,000 compared to 2 weeks to spend $5.7 million. So,
Yep.
or not spend it, but
And that's how much was awarded, 132?
$132,000,
Okay.
correct. The city of Ellis was awarded 160-some thousand as well, but that'll still be countywide, not just the city of Hayes. That's any business in Ellis County that can apply for those.
Very good. Thanks, Darren.
Okay, thank you, Darren.
Yeah, I'll get with JD and we'll create an agenda item.
Sure.
And we're happy to have you sign it, I'm sure.
Oh, absolutely. Yeah, absolutely. We'll
Thanks.
sign it.
All right, thank you.
Okay. Is there anyone else? Okay, is there any introduction of new employees?
Good evening. Mike Leiker, Ellis County IT. We have one new employee. She's not new, actually.
She looks familiar.
Lori Dreiling has come back to us. She had been away for a little while and decided to come back. So Lori's back with us in IT.
Well, welcome back, Lori.
Thank you. It's good to be back.
Lori got me through my first couple days of being a commissioner, so I'm glad to see her back.
Thank you, Justin.
Yeah.
Okay, moving on. We'll have a virus update. Jason?
Good evening, Commissioners. Jason Kennedy, Ellis County Health Services Director. So I think it's been a couple weeks since our last meeting here. Unfortunately, COVID is still here. As of today, new cases was 30. New cases per day, 7-day average. So we started reporting this a couple weeks ago. As we talk, this is all honestly a better indicator of the new cases. This number kind of resets itself because it looks back 7 days. So this number can be used if you want to figure out how many cases we've had in the last 7 days. You should be able to take that number times 7 and get pretty darn close. It's not always going to equal out exactly because it is an average. Active COVID-19 cases, 145. We have seen some improvement in that. Active hospitalization stands at 10. That number's been elevated for about the last month and a half because of 2 fairly large outbreaks we've had inside of long-term care facilities. That's also driving the increase in our mortality, and we will unfortunately continue to see an increase in the mortality probably for the next few weeks as those outbreaks continue to reach resolution. Generally, mortality comes around 3 weeks following infection for long-term care facilities. And we do know that unfortunately statewide 50% of the mortality comes out of long-term care facilities. So we will see that number to continue to go up, and that is unfortunate. The active hospitalization stands at 10. That's obviously just Ellis County hospitalizations, the recovered cases. Positive tests, 1075. As you can see, that number's less than the total cases. We've talked before, that's probable cases figured in. The state now is also including any antigen testing as a probable case. So if you go and get a rapid test in Russell, you're considered a probable case, not a confirmed case. So our probable cases has gone from 13 to 43 in about 2 weeks, and that's because of more people are bringing on rapid antigen testing. Percent of positives has decreased some, 12.3%, 7-day average percent of positive. Our percent of positive remains high, mostly because we're testing symptomatic people. We are, from the start, have always encouraged people to go see their primary care physician. If you're symptomatic, go see your primary care physician. 18% of people that are symptomatic return positive for COVID. So that number, unfortunately, will probably remain high unless we bring on some kind of a wide-scale drive-through asymptomatic testing like you see in some of the larger towns. They're mostly just using those to dilute the percent of positives so that they can do things or get things or have things open. So we will continue to push. We'll continue to follow CDC and KDHE guidance to test symptomatic people. If you're symptomatic, go see your primary care physician. Your primary care physician will determine your necessity for testing, as they are also the ones that can determine what kind of care or treatment follow-up that you might need. As we look specifically for Ellis County, graphically, as you can see, we are on the far right side now. We have seen modest improvement from our peak of about a month ago. Right around Labor Day was kind of our peak. That was also the peak of some of the Fort Hays State testing on campus. That was also the end of their asymptomatic testing there. Our percent of positive remains elevated, significantly elevated. I would love to see it quite a bit lower for one reason. If we get under 10%, we can open long-term care facilities to close family visits. If we get under 5%, we can open them up completely. What we've done inside of long-term care facilities, or what the state and the federal government have done inside of long-term care facilities, is truly appalling. We have had these people locked up for 9 months. They've not been able to see family. They've not been able to have any positive social interaction, which we're starting to see is having a significant detriment on their mental health and really just their overall general health. So if we can get these numbers down, we can open those facilities back up. We can allow people to go in and see family members. The overall mental status will be significantly improved, as well as the physical status of those facilities. The facilities themselves are not to blame. They are following KDADs, they're following KDHE, they're following CMS guidelines. They've done everything they can to protect these residents, but we need the community to do their part. We need to get these numbers down so we can open those facilities up and lead to some of those positive impacts for them. As we look to the future, obviously COVID is not going anywhere. There is no realistic end to this virus. Haven't heard much about the vaccine lately, but the last time I saw it, it was stalled in some trials. I do believe they're moving forward on it, but the time frame, who knows? We see reinfections in the state of Kansas, around 4.5 to 5 months. They're also documented nationwide. So we are seeing that you have durable immunity for maybe only 3 months. Where that leaves us, same place we started at 3.5 months ago. Don't gather in groups, wash your hands, socially distance as much as possible, wear a mask if you can't socially distance, and really just avoid those large mass gatherings that we know lead to high numbers of cases And we're going to continue to see cases increase and decrease as we have vectors or large spread type events. Any other questions?
Yeah, I have a question for you, Jason. Regards to long-term care facilities. Now, currently, residents in those facilities aren't allowed visitors. Is that correct?
They are allowed, so CMS changed their guidelines. I'm not sure on the exact date, but around 2 or 3 weeks ago, CMS changed their guidelines. They were pretty much shut down by CMS and KDADs. They could allow some compassionate care visits. CMS has changed their guidelines, relaxed the restrictions some, and allow certain individuals to go in, especially for compassionate care type situations. So end of life, they can actually go see their family member. But the percent of positive that we still need to get to for CMS to really allow more of an open environment would be 10%, and then they're allowed to pretty much open while using engineering controls, masks, cleanliness, all that kind of stuff at around 5%.
So while these people, the residents in the nursing homes, they're not allowed routine visitors of any sort, yet staff inside the nursing homes is diligently following the guidelines for protection of these individuals, and yet we're still seeing
Yes.
caseloads going up. Is the PPE effective or not?
You know, that's, boy, I'll tell you what, you touch on one of the hottest subjects in the country right now. Do masks work? So, yeah, doctors say they do. Studies say they do. They do limit or reduce your risk of transmission. Do they eliminate your risk of transmission? No. No, they don't. They don't eliminate your risk of transmission at Walmart. They don't eliminate your risk of transmission in long-term care or at the hospital. But they do believe that the studies do show, and there is getting to be a significant amount of evidence that shows that they do lessen that impact or reduce it in some way. Long-term care is truly one of the situations that is just it's sad in that they have done everything. Those long-term cares have truly gone above and beyond. They've done everything they can to try and limit that spread inside those facilities, and we still see it happen. Just like you did with rhinovirus or with flu or with UTIs, any of that kind of stuff that we saw spread through facilities like this. It is a virus at the end of the day. It does two things. It replicates and spreads. That's all it's designed to do.
Now, you said there's 10 cases hospitalized.
Yeah, we currently have 10 Ellis County residents hospitalized.
Is the hospital have other COVID patients who are not Ellis County residents?
Yes.
Are they stressed for rooms and resources?
No, the hospital's come out quite a few times and said that they have sufficient capacity. They are able to deal with the current numbers of patients. I do think, and I won't speak for the hospital. I've not spoke for them before, but I do think nationwide we do share some concerns with as flu season and other viral seasons start. We do share some concerns with. There will be more patients, but we are not going to overwhelm our healthcare system. We are not going to overwhelm the entire complexity of the healthcare system in Kansas. I think most of your rational leaders have come out and said that that's not going to happen. Will there be certain times where they will be stressed for resources or they'll have certain issues, but they have surge capacities, they have other abilities to deal with patients, they have internal changes that they can make, which is why I don't report their numbers and I don't speak for them because they control their facility. Mm-hmm. They call me when they have an issue and we look at it from there, but right now they do not have an issue.
Okay, good. Commissioner Roth.
Yeah, just a couple questions. Could you allude a little more on this rapid antigen testing? I know we talked probably a month ago, and the discussion was, well, I guess it was during CARES Act funding, how if we can test people in 15 minutes, if we can do these type of things to try and get people, for example, like the NFL is able to do and know within 15 minutes whether or not you're infected or not, how much closer are we as an economy and as a healthcare system to having that more readily available out here?
So It's here. We have it. We've had it from the start. The hospital, like we've talked before, they prioritize it for emergency type cases, people that need an emergent type procedure. We don't have, in Ellis County, we don't have widespread rapid testing right now. We've tried. I've tried really hard to get the Abbott ID now. The cards, they're non-existent. Any other facility that I've tried to partner with to purchase machines or to look towards a rapid testing setup aren't taking on new customers because they don't have availability of the reagents that are needed. The exciting thing about the Abbott card is it doesn't require a reagent. It's like it's more of like a rapid flu test or rapid strep test where everything's self-contained right there. You put it in there, 5-minute results. I think it's 5-minute results, and it's like $5 for each one of them. The federal government purchased all of them, and they are allocating them to the state level. Where they go from there, we honestly don't know. We've received some indication that they want to prioritize it for testing in K through 12 situations. They're not real sure what they want to do with it or what their plan is. So, unfortunately, I would tell you we're probably not much closer than we were a month ago, but at least it exists now. It didn't exist a month ago. So now it exists. It's not a proof of concept. It works. They are somewhere in the ether, but they're not here. So,
Okay. Some good news. There's always something that I always want to hit on every time we discuss these is how much better we're getting at treating COVID-19 and the mortality rate going down in those situations with therapeutics. I mean, I think everybody who watches the news has probably seen that our president has COVID-19 and was able to be treated with therapeutics, and within a few days is back in the White House and back to work, and never really had much issue with it that we know of. One thing that I think that we haven't done or talked about, we've talked a lot about masks, we've talked a lot about staying out of groups of people, we've talked a lot about those type of mitigating measures. One thing I wondered if you could allude to is the other things that we see or look at online, which are how we prepare our bodies to deal with it if we are going to get it.
Sure.
So what's some good things to tell people to do in order to be prepared for one, flu season and possibly the contraction of the coronavirus and COVID-19?
This might be the only time in the last 5.5 months that I've actually had an answer for you.
Okay.
Go for a jog and stop smoking. Like if we're going to mandate health, go for a jog and stop smoking. Like you are correct. The healthier we can be as a population, the healthier we can make ourselves, the better we are to deal with any virus. It doesn't matter what that is. Right now, it's highly important that everybody gets their flu shot. It's also highly important that we stop seeing we've seen a lot of people that are not going to see their primary care physicians because they're afraid to leave their homes, or they're afraid they're going to get COVID at the doctor's office. They're going to be by someone that might, whatever. So we need people to go back and see their doctors. Let doctors be doctors. You're right. They're getting a lot better at caring for this stuff because doctors are phenomenal. We have a great group of them in this community. They're very highly intelligent people that serve one function. They want to heal people. So they're looking for everything they can. And so get your flu shot, get active, eat healthy, stop smoking, stop drinking, especially don't drink and drive. That's a really bad combination.
Yeah.
But really just general overall health is the best way to beat really or combat any virus that you don't have a vaccine for. All of those measures will also make you more able to deal with the flu, to deal with cold, to deal with anything that we look at. Some of the common risk factors for COVID is what you alluded to already, but we look at obesity, we look at diabetes, we look at heart disease, lung disease, hypertension, all of those. We can make significant impacts with personal choices, like I said, going for a jog, stop smoking, stop drinking, and just generally be healthy. Get your flu shot, get your vaccines, keep an eye on yourself, watch yourself, make sure you know what your symptoms are, and if you're symptomatic, go see your doctor.
I've seen a few things about vitamin D deficiency because that helps your immune system, vitamin C, more citrus fruits, things like that normally we would not think about in the spring, summer, fall, but maybe is more important than ever to help our bodies be prepared if we were
Sure. I've told you before, I'll duck any question that I possibly can. So this is one. I'm not a doctor. If you're thinking about some kind of a regimen like that, especially if you're going to use over-the-counter medications, or you're looking at anything that you're looking at changing something, even if it's going for a jog, I highly recommend everybody does that. You go for a walk, something like that. But if that's a huge change for you, or if you're looking at bringing on vitamin D, vitamin C, something like that, you need to call your primary care physician. You say, hey, this is what I'm thinking about doing. I'd like to even start exercising. You think, well, exercise is good for everybody, right? Yes. But if it's something that you haven't done in 25 years, you maybe want somebody to give you a little help, a little guidance, a little oversight of how to get back into that. Same thing with those regimens you talk about. There's a lot of information on the internet. Most of it's trash. There's a lot of information on Facebook, and all of it's trash. So, but as you look for that stuff, just make sure that you work with your primary care to determine if that's going to be helpful for you.
I've always wondered about that. The probably my biggest regret from the CDC over this is that they haven't told us those things are incredibly important. And as you alluded to, don't try to take on a 5K if you haven't done that in the last 10 years like I have, but because you might hurt your heart in the process and not feel good from that. But for sure, I think that as a government entity, we've done our best to try and tell people how to avoid this. And as we see that it's pretty tough to stop this thing from spreading, even the leader of the free world has now contracted it. I think that it's important for us to maybe do a little better job as a government to do the things you just said. Stay healthy, make sure your lung capacity is up, because if you get it, we want you to be able to get through it and not to have to put a strain on our hospital, to be able to handle it like 99 point whatever % of people that contract it do. So,
Sure.
But that was just something that was weighing on me, and I'm glad you put that out there for everybody.
Sure. If you're going to make any changes in your life, any significant deviations from what you normally do, you should probably talk to your primary care physician. If that's getting better or getting worse, if you want to start smoking and drinking and you haven't done it in 25 years, maybe give your doctor a call. I'm guessing he's going to have a different plan for you.
You'll say no on that, I guess.
Yeah, it's we are at a point now where personal decisions are what we need from people. We need people to make good personal choices to protect themselves, and really making a good personal choice to protect yourself will protect those people around you as well. We do see some improvements in Ellis County, which is great, but we need to keep that trajectory. We need to keep going in that direction, and the only way to do that is good personal choices.
I think mental health is the last thing that we should hit on, and we have a great mental health hospital here, but I'm concerned about people and their mental health through this crisis, and don't be ashamed to go ask for help, to go have somebody take a look at you if you're sad or you're having issues with anxiety or depression. It might be the only time in your life that you have that because of the extenuating circumstances, but they can surely maybe help you through it. And as I've seen a couple friends with true issues with that never seemed that way before, I want everybody to try and stay at the peak of their health to be able to handle it health-wise, and then I guess we'll deal with the financial aspect of it as we go.
Sure. And it's wellness is more than just physical. Mental, financial, social, spiritual, all of that goes together to make truly a well person. And I'm, like I said, I'm not a doctor, but the good thing is that we have, mental health doesn't carry the stigma that it did 15, 20 years ago. It's okay to say, I have a problem. It's okay to go get the help that you need, and I highly encourage that. Being physically well, going for a walk, eating healthy, that stuff all helps battle mental issues too. So it's, make good personal choices, and one way or another, we'll get through this.
Very good.
Take care, Jason.
Thanks, Jason.
Our next agenda item is the appointment of voting delegates to the KAC virtual conference.
The KAC has contacted us. This is actually due. This is actually due tonight. They gave us time to get this set for you all to decide who you'd like to appoint to KAC, the virtual conference.
I believe, who did we have last year, do we recall?
I believe it was Dean. I think since Dean didn't make the meeting and he has to do all the KAC anyway, I
he
think we
should
make
be
him do it
He should
again.
be the man.
There you go.
Yeah, Dean is on the KAC board for people that don't know, but I think Dean could very well be our delegate, and he will have to be a part of those meetings anyway, so.
Did you want to be an alternate?
I can be the alternate, that'd be fine.
Okay.
I need two alternates, a first and a second.
First one will
I'll
be
be first,
Commissioner
and
Roth.
we'll
I'll
have
be the second.
Commissioner Sliders second.
Thank you. We'll get that sent in tonight.
Okay.
Awesome. Thank you.
Sounds good. Okay, then, County Administrator report.
Okay, thank you. I just have one item on the agenda to visit with you about this evening. Our CARES program is up and it is hopping right now. Last week, we had some 32 payments go out, which was our first payment batch, and that totaled $660,000 and some change. This week, we are targeting Thursday for another batch payment to go out. And already we have $734,000 and some change set to go out, and I anticipate a few more trickling in before Thursday. So it's very, very busy, lots of emails, people calling. I'm trying to help them. Some of them are, well, this didn't quite work out, and what else can we do? And so I've been trying to work with them as much as I can to help them be successful with the project they're trying to do. Of course, a lot of them are loss of revenue. Those are the easier ones to deal with because they just prove that they had the loss and send the paperwork in. But the projects are the more difficult ones because their project has to meet the nexus with COVID, and we're trying to help them as much as we can. So, yes, things are hopping right now.
And J.D., how is Ellis County coming along with the purchase of the ambulance?
That is coming along well. It looks like Jason left. It is in process now. It is being built. We do have a contract on it, and it's still anticipated to be delivered before the end of the year.
Oh, okay,
Yes, sir.
sounds good.
Uh-huh.
Yeah, I did have a talk with Jason about that ambulance. He said he had it purchased. I guess it'll have a few more bells and whistles than we're used to in Ellis County. I think usually we try and choke some of that down, but in lieu of needing it done immediately and stuff, he was able to put our name on it, and we were contractually obligated to it as long as we could get CARES funding for it. So I don't think that's going to be an issue to
Okay.
get in.
Sounds good.
And our one last thing, I guess, our biggest project of all, the CAD system, that is going along well. Darren has headed up a flurry of activity that's going on with that, a number of meetings that have been had, and that is going well. They have been meeting with the vendor that we'll be working with, and also a purchasing advisor, and so that also is coming along very nicely.
How about the shower data room conversion? How is that coming along? Do you
I think
know?
that's scheduled. Mike is here. He might be able to address that a little bit better, if you don't mind, sir.
Sure. We're still waiting on a second quote or multiple quotes on the shower construction, but that is moving along, and we are we're getting equipment in here to set up the servers and rack and things like that. We will stage it here because the shower, that has to be done before we can move the equipment in there. So we'll stage here, we'll do some pre-configuring here, and then when that construction project's done, we'll move everything there, and that'll be its permanent home then. So but we're still waiting on quotes back for that.
Okay.
JD, one last question
sir.
on the CARES funding. I was going through the list. It looked like a lot of the nonprofits were right on top of it. I mean, it seems like of our distribution, a lot of them were ready to go. What's the best way for all these for-profit entities in terms of, from our perspective, that we can help them know that, they're approved, they need to get this paperwork to us. It is a significant amount of money for almost every single one of them.
Right.
What's the best way of making sure they keep on top of that so we don't leave some of this money on the table?
Well, I guess a couple of things. So I have emailed individually each business, each nonprofit, and send them a personalized email to let them know their amount of funding, what they needed to do. And I have not gone back through to circle back with those that haven't yet answered. I thought I would wait until after this second run because it's only been a couple of weeks now.
Okay.
And then I would circle back with them and have a follow-up with them to let them know. Probably I'll email them and probably phone call them as well. I'm happy to share any of that with any of you if you'd like to have that, who still hasn't contacted us yet, but we will be able to do that, though.
Okay.
My only concern is a no call, no answer type of situation where money is on the table. What does that turn into? Say we cannot get contact, or they email us back and say they're not interested anymore.
So that will come back on the table. I am
Okay.
keeping a list of additional requests that we've received. One was from a school. I think I've talked to all of you about
Yep.
that one school, and it's not a lot of money that they're going to need. And then today I received another phone call from another school that has an interest in if there's additional funding available. So I'll keep a list if that's okay, unless you all have a suggestion. Otherwise, I thought maybe we would see if there's money left on the table, and then we can figure out how to reallocate that then.
No, I think that small, any of those small requests, especially those schools, seem like to be the best use of that funds if there comes on the table.
Mhm.
And I think if there were extra at the end, I do recall that Fort Hays State University took a lot of money off the table. I think $500,000 in order to fund these nonprofit organizations, which is incredibly beneficial to the community around them that they know needs to thrive for their success. So I think an open conversation with Fort Hays State, if any more money comes back available, that they can pursue whatever avenues they were thinking with that $500,000 might be worthwhile to consider in terms of if money comes back on the table.
And we will have an opportunity to look at, as we get toward the end, some additional expenses that we experienced that we maybe didn't submit initially with the reimbursement part. So things like salaries and things like that we can look at as well.
Oh, absolutely.
Yeah.
Thank you.
You bet.
Okay. Anything else,
That's it.
JD?
That's it, sir. Thank you.
Okay. County Commission reports. Dustin?
I have just a couple things. This morning, I was able to attend it was a rally, I guess, underneath the Union Pacific Plaza. We had Roger Marshall was there, Congressman Marshall was there, and Tracy Mann, who is running to be our next congressman. Representative Wassinger was there. Representative Rogers was there. The AG, Derek Schmidt, was there. So it was a really good turnout this morning. It was great to see all those people. And, you know, the only other thing that I had was that I was able to accept the nomination of being the county chair again with a unanimous vote. And so I will be the Ellis County Republican Party chair for another couple of years, which is not the most fun or easy job, but it's something I guess that I get a kick out of on occasion. So that's it for me.
Okay. And just a note from me, as Donna alluded to earlier, my wife and I came in last week and helped Donna with some election stuff, and we processed approximately 650 envelopes, getting them ready for ballots. And Donna kept us pretty busy. And it's my understanding the ballots aren't even supposed to be here until the 9th. So there's only a short period to get all of those envelopes stuffed with ballots once they get here. So a lot of work involved in that office right now, getting ready for this election. Okay, and we have an executive session. I'll make a motion, we go into executive session for not more than 30 minutes for non-elective personnel issues in regarding the vacancy in Public Works. Those included in the executive session are the Board of Commissioners, Councilor Jeter, Administrator Cox, and Public Works Director Ring.
I second that.
I have a motion and a second. All in favor say aye.
Aye.
Motion passes 2-0.
And I need your signature, please, for Darren this on that piece of paper.
We'll sign it here.
Thank you.
Are we adjourned, Mr. Chair?
Yes, we are adjourned at 6:14.
Okay.
Chiefs have already kicked off, so I'm getting.
Yeah.